and thank you for having me. I'm going to go ahead and present my slides now. So let's see here. Okay, present share screen. Let's see, entire screen and share. Hopefully folks can see that now. And I'm going to put it in slideshow mode. Okay. So thank you again for that lovely introduction. Good morning, everyone. I'm Martin Mendoza, and I serve as the Director of Health Equity for the All of Us Research Program at the National Institutes of Health. Just so delighted to join the group today, and looking forward to a great day today. Okay, so overview for today. I'm going to start out by giving you a quick overview of the All of Us Research Program and a quick update on our enrollment numbers. Since I'm assuming most of you were at the previous talk and don't need the full overview. I was also asked to talk today about 4 innovations that the All of Us Research Program has done. So we'll cover those as well as ways that you can collaborate with the All of Us Research Program. Okay, so let's go right into our overview. So the mission of the All of Us Research Program is simple but bold, and that's to accelerate health research and medical breakthroughs to enable individualized prevention, treatment, and care for all of us. The program aims to create a new model of research based on building and maintaining relationships with participants for decades. And in particular, we want to deliver a valuable, rich resource and repository of data that will be broadly accessible and safe. And finally, we will do what it takes to catalyze a robust ecosystem of researchers to use this national resource. Over the past few years, we've been rightly focused on our participants, ensuring we are enrolling and retaining participants from diverse backgrounds. And while we continue to work on that, we've also simultaneously turned our attention to the researcher ecosystem. And in particular, we must ensure that researchers from underrepresented communities can utilize the program's resources. And I'll talk more about this in today's presentation. Okay, so let me share with you where the All of Us Research Program is today as far as enrollment goes. We currently have over 600,000 participants who have signed the primary consent to join the program. More than 420,000 participants have completed the initial steps of the program. And we have over 350K electronic health records from participants, which are being utilized by researchers to study different diseases, health disparities, wellness, etc. And then we also have over 435,000 biosamples, so blood, urine, and saliva. So the program is really seeking to achieve diversity with an emphasis on including communities that have historically been underrepresented or excluded in biomedical research, which you may see abbreviated as UBR. Again, underrepresented in biomedical research, UBR, important acronym for today. So looking at the chart on the right, you can see that we're really having some huge success so far as our efforts to go focused on diversity. So our goal is to have 75% of participants come from these UBR communities. So that includes not just race, ethnicity, but sexual gender minorities, those with low income, rural populations, those that self-identify as disabled, and other populations that you can see on the bottom right. So our goal is to have 75% of our cohort be from those populations, with 50% being from self-identified racial ethnic minorities. So far we are at 80% for our UBR communities, and we're just under 50% at about 48%. So very close to our target. So this is where we are today with enrollment. Okay, so now that you know a little bit more about the program, I want to turn our focus to innovation number 1, and talk to you more about why it's so important to have a diverse cohort and what we're doing to ensure that, which is really based around our innovation around community engagement and participants at partners. And so to be really clear here, partnering with communities and grassroots community engagement is foundational to the program. So I'll go into some of those efforts in the coming slides. Okay, so as I mentioned earlier in the presentation, all of us has made major commitments to the engagement of individuals underrepresented biomedical research. And this is led by our Division of Engagement. And so central to those engagement efforts is this engagement ecosystem, which you can see depicted here, and which we really see as national in scale, but also local in focus. So since the beginning of the program, partners in this ecosystem were selected with UBR communities in mind. And it is those partners that have now come together to form the engagement ecosystem you see here. So we like to think that this ecosystem enables all of us to be both wide through national partners and efforts, as well as deep through local organizations and community advisory boards. And in fact, these partners often work collaboratively to reach specific populations with tailored strategies and assets. And reflective of our core values, we also look to these various organizations as true partners and experts within their communities, and often ask them to work with us on developing tailored strategies and assets to reach and engage with specific populations. So in order for that engagement ecosystem to be successful, all of us relies heavily on trusted partners to help facilitate our engagement activities. For example, through our collaborations and efforts of our engagement division, we've been able to establish over 100 strong community partners like those reflected here. Our partnerships like those with the American Association of Health and Disability, PhD, and the Mobile Engagement Asset, which you see top middle, which is our Traveling Mobile exhibit, have allowed us to connect to the disability community. And through partnerships with the National Baptist Convention USA, we were able to leverage the togetherness of the Black faith-based community. Also, all of us is also working directly with communities to create safe spaces for important conversations about history. We want to provide potential participants with information that allows them to make a choice about contributing to a health database, which will be used for medical research. So this network of community and provider organizations are working every day with their communities to help facilitate these important conversations. So the program has been intentional in terms of diversity within the community and provider partner network, as well as diversity within the program's participant community. So this network, as you can see, is incredibly diverse and includes community organizations, faith leaders, social service organizations, and healthcare provider organizations. There's also great diversity in how these partners engage with their communities, the engagement models and messaging they use to meet the community members and potential participants where they are along their engagement journey from program awareness to participation. Okay, next slide. Okay, another core pillar to the All of Us engagement portfolio are our participant ambassadors. So participant ambassadors provide input on overall engagement strategies for the All of Us research program and have the option to serve on governance groups and attend the annual in-person meeting. So partners from each regional medical center, federally qualified health center, direct volunteer, and the Veterans Administration sites, they nominate members to serve as participant ambassadors. So some of the ways participant ambassadors engage with the All of Us program is they participate in monthly meetings, they provide feedback and input on All of Us activities and priorities. They help identify ways to make the program relevant to participants by identifying challenges, barriers, and opportunities. They serve on governance committees, boards, task force, such as steering committees, advisory panels, executive committees. They deliberate on issues presented from the All of Us research program, and they suggest new activities, including participant-led projects. So here are the current 29 participant ambassadors for the All of Us research program. The inclusion of these ambassadors and the diversity within the group are just a few examples of how we seek to live these core values that I talked about earlier. These ambassadors come from all over the country and have worked in various fields, including medical patient advocates, clinical educators, and nurses. And again, it's really hard to overstate just how critical these folks and all of our participant partners are to the program. All of us simply cannot function without them. Okay, innovation number 2, boosting underrepresented biomedical research engagement for researchers. So I just told you about our participants. Now we're going to transition to researchers. So as I mentioned previously, I shared with you our commitment to engage in enrolling diverse participants and why that's so critical to the success of the program. But equally important are our researchers and the diversity of that group, because without them, it would not be possible to translate all that valuable data from our participant partners into research progress. And so to that end, we want to engage diverse communities, not only as participants, but as researchers who are on our data platform, bringing perspectives informed by a broad range of expertise and experiences. We absolutely believe that having that diversity of researchers allows for fresh, creative perspectives and questions to be asked with hopefully innovative research outcomes to follow. In line with that commitment comes our dedication to establishing equitable access for researchers from many types of institutions and organizations, and supporting these researchers by providing access to training and tools to aid in their research. So one of the main tools we've established is the Researcher Workbench, which I'll talk about in later slides. And this allows registered researchers to access specific data for specific research projects. And specifically what you're looking at here is our control tier. So in case you forgot from the last presentation several months ago, our control tier is the area of our Research Workbench where researchers can access genomic data among other data types. So since launching in May 2020, the Workbench has over 3,200 registered researchers and over 2,500 plus active projects covering topics from various diseases like cancer, heart disease, healthcare access, SDOH, and others. We also have over 100 publications that have been authored using All of Us data. And referring back to the diversity of researchers using the database, out of over 400 organizations, 24 come from HBCUs, historically Black colleges, universities, and over 30 come from Hispanic serving institutions. We're also seeing considerable diversity at the level of individual researchers. And more specifically, this is in terms of not just race and ethnicity, as you can see on the left, but also in terms of career level, which you see on the right. What's especially exciting here is engagement we're getting from individuals early in their research career, starting as early as undergrad and high school trainees. So in addition to bringing greater representation to more diverse groups of participants, the program is deeply committed to involving more diverse researchers to take part in genomic research. And so a little bit more about our efforts to engage with these diverse researchers. In March of 2022, the program held a researchers convention in collaboration with many consortium partners to showcase the work of AOU researchers with colleagues, peers, and others who share a passion for advancing health research. The two-day virtual event, it focused on researchers at various educational and professional career stages across two separate events, the Minority Students Research Symposium and Science Day. So the first of those events featured the work of 32 student researchers from underrepresented communities in the biomedical workforce, along with their mentors who created poster presentations from the All of Us data. And to our surprise, but also delight, it was a high school student that ended up taking the top prize at the event. And because that event was so successful, we plan to have another similar event in the near future. Okay. And so in the previous couple slides, I've talked about just how important research diversity is to us, but also want to make sure that that for those diverse researchers, we really have, and really all researchers that decide to register for access to the Workbench, we want to make sure they really feel supported with the necessary tools and trainings for them to be successful. So if you decide to become a registered researcher with All of Us, not only will you gain access to the Researcher Workbench, but you would also have access to training workshops, webinars, and office hours to help become more familiar with the data and the Workbench itself. A newish addition to the program is a group of individuals known as our research ambassadors, so similar to our participant ambassadors, and they serve as trusted peers and colleagues who can inform and help motivate their research networks to register and use the Workbench. So bottom line, All of Us is really committed to making sure we provide as much support as possible to our researchers. Okay, innovation number 3, diversity of data and access and use. And so as I previously talked about, All of us is working to earn the trust of communities previously disenfranchised by medical research and engage them in safe, protected ways that can help enable a deeper understanding of disease biology and more precise approaches to care. So historically, the diverse data needed to paint a complete picture of human health, biological, environmental, behavioral, and sociodemographic. It's not been easy to capture all in one place. So through the All of Us research program, we're bringing all this data together on a single platform and working to ensure it's not only secure and protected, but also made available to diverse researchers, as I talked about previously, within a wide range of settings. So data captured by the program includes survey responses, physical measurements, biosamples, electronic health records, and data from wearables, with more genomic data forthcoming. And so it's really this diversity of different data types that I just listed, combined with how the All of Us data set follows participants as they move, age, develop relationships, get sick, and try new and innovative treatments. So together, those different data types, as well as what I just mentioned about how the data set follows participants, is the third innovation that I want to talk to you more about. Okay, so let's talk about the All of Us Research Hub, which allows for tiered data access, ensuring data is available to the public and researchers. So this public tier includes access to aggregated data that provides overviews of participant characteristics and data types. So individuals can also review the types of questions asked of participants by reviewing the Survey Explorer. So participants can also review the types of research taking place by reviewing the Research Projects Directory. And again, this is all publicly available, no login needed. And for those that decide they would like to become registered users, they can access curated individual level data and a variety of research tools to conduct a wide range of studies and new data, including SDOH and additional COVID-19 AHR data. So registered researchers, which does require login, also have the ability to access the registered tier and the control tier, which includes access to expanded demographics, genomics, and other data. So let's talk a bit more about the public tier, which is the most basic level of the Research Hub, and includes something called the data browser. So the data browser allows anyone to learn about the type of and quantity of data that All of Us collects. Users can explore aggregate data, including survey responses, physical measurements, HRs, and wearable data. Again, no login required. Let's move one level up to the registered tier. So if you recall, All of Us is building this data platform to support researchers on many aspects of health. No single medical or biological research question. So that point is key. The program is enabling research, not performing the research. So there's a lot of data available to register to researchers in the registered tier. Again, over 300K physical measurements, over 250 electronic health records, nearly 13,000 Fitbit records, over 400K survey responses, as well as genotyping arrays and soon over 100K whole genome sequences. And finally, our control tier. So in March of 2022, we reached an important milestone with the release of our initial genomic data set. Nearly 100K whole genome sequences and 165K genotyping arrays are now available within the researcher workbench, less than 2 years after the beta launch of the platform. So this data release not only positions All of Us as one of the most diverse genomic data sets of its kind, but it adds to the richness of the data already available in the workbench. So this genomic data is integrated alongside information from surveys, physical measurements, EHRs, wearables, and others. Okay, so and importantly, this genomic data is having an important impact on diversity within genomic studies. With just our first genomic data set released in 2022, a GWAS from All of Us was much more diverse compared to all global GWAS studies. So of those 100K whole genome sequences, 50% were diverse by race, ethnicity, and 80% of the data set was from participants from UBR backgrounds. Okay, innovation number 4, return of value. So as I mentioned previously, returning value to participants is a core value of the All of Us program. Participants can learn about their own health through the information they have donated to the program by receiving genetic information, comparative information about the surveys they take, and access to the HR claims data they volunteer to share with the program. Participants can also receive aggregate results and scientific findings from the research their information supports. And finally, participants can continue to be a part of biomedical research through opportunities to be contacted for other research projects, so specifically ancillary studies. So 2022 has been an exciting year for returning genetic information. So when participants donate a biosample, all of us can return genetic ancestry and trait information to them. This is information like what region of the world your ancestors are from, and how your DNA is related to traits like whether you like cilantro or what your wax looks like. Gross. As of January 9 of last year, over 200K participants have been notified that they can receive this information, and 70% of these participants have gone through the steps to actually receive it. And then a very exciting achievement this year is that the program has begun releasing genomic health-related return results, or GHR3. This is information that participants can use to be more informed about their health. They can receive reports on their hereditary disease risk, for example, BRCA, and they can also learn about their genetics, how their genetics may interact with the efficacy of certain medications. So through this process, participants can choose what results what results they want once they have donated a biosample. Clinical validation labs analyze their samples, and then the interpretation of these results is supported by a genetic counselor. So since its launch on December 13th, over 11,000 participants have been notified of these results, and over 4,000 have seen the results. And the program is already preparing to notify another 160K participants or so. It's also important to note that in the case of a pathogenic result from a participant is discovered, the participant will only be able to access that result in the presence of a certified genetic counselor who can explain what it means. And of course, that service is free of charge. Okay, so last part, connect and collaborate with the All of Us Research Program. So two ways you can do this. One, through open funding opportunity announcements. So there are opportunities to become an engagement, a communication, and enrollment partner with the All of Us Research Program. You can, there's opportunities around data linkage, as well as reporting back environmental health and non-genomic research results. The other way is to join the All of Us Community Advocate Network. So no funds are exchanged in these programs, but the Community Advocate Network is comprised of organizations that are dedicated to speeding up medical research and have missions and goals that align with those of the All of Us program. Community advocates serve as experts in their respective communities. They share information on the program, and they take these concrete steps to raise awareness of the program, integrating information around All of Us into existing programs and efforts where appropriate. So to wrap things up, my call to action, please scan the QR code to learn more about the Research Hub, and visit Join All of Us if you think you may want to join the program as a participant partner and ensure your community is represented in biomedical research. And that concludes my presentation. Thank you very much.